In the UK, there are more than 100,000 strokes every year, causing 38,000 deaths, making stroke a leading cause of death and disability. And according to the US statistics, 23% of stroke victims are likely to have a second stroke. As strokes are so common, I want to understand more about what a stroke is and what we can do to lower the risk of having one or even two. Health Explorer Neil Fellows here, and if you want to get healthy and fit and stay healthy and fit and do it in a way that's unique and natural to you, please subscribe and hit the bell to get notified of all of our latest interviews and reviews. On this channel, we're interested in prevention and what we can do to avoid ill health. And joining me to discuss how to reduce the risk of having a stroke, as well as stroke causes and symptoms and how to avoid them, is lifestyle coach and nutritionist Dr Chris Pickard. So, Chris, tell us, what is a stroke?
Well, a stroke it's basically when you get a lack of blood supply to the brain, so a lack of oxygen, and so basically the brain stops working. That is a stroke, basically. The brain stops working for some reason because there's a lack of blood supply to it.
So are there different types of strokes, or is it just that one thing?
Yeah, well, there's two main causes of an interruption to the blood flow to the brain. One is what's called ischemic, where basically there's a clot. So a clot stops the blood flowing, and so that clot can come from somewhere else in the body, from another clot that's been released, and then it lodges in an artery in the brain, and that stops the blood flow. And the other one is where the actual vessels of the brain itself leak, and so that's called a hemorrhagic stroke. And then there's kind of two other sort of types, which are called transient ischemic attacks, or mini strokes, when they're just tiny strokes that don't cause a major stroke. And then there's also what are called silent strokes, which are strokes that no one even notices until they've had 3 or 4 or 5 or 6, and suddenly they've got basically symptoms of dementia. So there's two main types, and then each of those can also cause either the minor strokes or the silent strokes as well.
Got you. Okay. So what are the early warning signs of a stroke?
Well, the early warning signs are, well, basically when you're actually having a stroke, because there's no way, as far as we know, there's no way actually before you're actually having a stroke, there's no way to tell if you're going to get a stroke. There are risk factors, which we'll cover in a bit, but the early warning signs tend to be, there's a couple of great acronyms. I can only ever remember one, which is FAST, which is basically if someone's face is drooping a little bit, or they've lost power in an arm. So if someone's kind of slumped down and the face is drooping, or if they're slumped down, check to see if they can move their arms. Have they got any numbness or paresthesia around the body as well? Are they slurring? Is their speech slurred? Yeah, as well. So those are the common ones. And then you've got to act fast in a stroke, because the sooner you take action, the less likely there will be any long-term side effects. And I may as well say this because it's kind of important that if you do suspect that someone's had a stroke, you need to call, the emergency services straight away. And if you suspect a stroke, don't give them anything to eat or drink. Okay. Keep them warm, maybe. If they can't actually move, then don't move them. If they can't actually move themselves, but don't give them anything to eat or drink, because when they get to hospital, they may need something, and if they've eaten or drinking, it can stop the doctors from acting as much as possible. So if you're at all in doubt with someone, then don't give them anything to eat. Just get on the phone to emergency services. Yeah.
Are there early warning signs that a GP or even a specialist like a cardiologist might actually even miss?
Well, none of the immediate signs of having a stroke, although they could be put down as something else, like if you've had lots of silent strokes, it could be put down as dementia. But there are all kinds of weird things that can happen as well. And the weirder things happen more in women as well, such as sudden change in behavior for no apparent reason. That can actually be a sign of a stroke. There are some other sort of weird ones, like hiccups in a woman more than a man as well, can be a sign that you've had a stroke. So change in behavior and hiccups in a woman could have been a stroke. seizures, pain, irritation, hallucinations, fainting, general shortness of breath, confusion. It depends on which area of the brain is affected as to what symptoms someone have while they're having a stroke.
Yeah.
And the weirder ones tend to be, for some reason, more often in women. But where you can really make a difference is actually understanding all the underlying risk factors of a stroke, which are all the predisposing problems. Would you like me to read out a list?
Yeah, let's talk about risk factors. I mean, I heard you mention it a second ago that you wanted to talk about it. So let's do that.
Okay, so basically, with both hemorrhagic strokes and ischemic strokes, there are slightly different risk factors, but the number one risk factor in both is high blood pressure. Because if you've got high blood pressure, you're more at risk from having a clot in the brain, but you're also more at risk of having bleeding into the brain. So if you have high blood pressure, the number one thing you can do is look after it. And here's one of the tricky things that isn't really understood a lot, is just containing the numbers with drugs doesn't necessarily decrease your chance very much of having a stroke. Because while increased blood pressure itself can actually increase the damage to arteries and cause more bleeding, very often the reason that you've got high blood pressure can also be the reason why you've got weakened arteries in the first place, or likely to have a clot. And just lowering the numbers doesn't lower the causes of blood pressure. And it's been shown that the more pills you have to take to lower your blood pressure, the more at risk you are from having a stroke anyway.
Wow.
So someone who's on 3 pills to lower their blood pressure has got 2.5 times the risk of having a stroke than someone who doesn't have to take any blood pressure pills at all. So the more blood pressure pills you take, the worse it is. You've got to find the underlying causes. But smoking is another cause, and that can cause high blood pressure. Diabetes. There are some genetic factors as well for both. But then there's previous brain aneurysms, rheumatoid arthritis, high levels of stress and anxiety, recreational drug use. But these are 3 big things that just get completely ignored by doctors, which is a lack of sleep. So if you're chronically lacking sleep, you're at more risk of stroke and diabetes and obesity and lots of other problems. Low levels of activity. We know that exercise is so good for us, but if you're not exercising, that is a risk factor for stroke. And then this is the big one, and it's getting worse and worse and worse, is exposure to air pollution. And the thing is, we now know that Inuit Indians, so Eskimos basically in Alaska and northern Canada, are actually at risk from getting high blood pressure from air pollution. And they're miles away from industry. So air pollution is, I think, the biggest missed underlying risk factor for high blood pressure, strokes, cancers, breathing disorders, you name it.
Wow.
So there's a lot of risk factors, and I think a lot are completely ignored by modern medicine.
So it's a huge one. Air pollution. I mean, so what would be some of the sort of like symptoms and challenges that people are left with after having a stroke?
Well, again, it does depend on where in the brain the stroke is and just the recovery afterwards. Because some people can have a major stroke, so they can be falling to the floor, they can be slurred speech, they can have lost the functioning one side of their body, and in a matter of days it can all come completely back. Where some people can just get a slur and a bit of tingling and it never goes away. So there's how severe the stroke is at the time. There doesn't seem to be any indicator of how severe and long term the problems are going to be. But typically a bad stroke, you're looking at slurred, they have to relearn to speak again. The arm can or the leg can stop working, and they're left with, an arm or a leg that doesn't work properly. Or if it's another area of the brain, their cognition goes, their eyesight can go, their hearing can go. Fatigue, dizziness, forgetfulness. It's so varied. It's so varied that but the typical ones are one side of the body is not working properly.
Sure. So how could we reduce the risk of having a first stroke or even a second one?
Well, let's start with the second stroke, because that's where some medication has been shown to help. And so, again, I'm not a medical doctor, so I can't tell you to go and take these. But if you're a woman, it has been proven that taking 100 milligrams of aspirin every other day, not every day, every other day, if you've had a stroke, can decrease the risk of a second. This is an ischemic stroke.
Yeah.
Whereas if if you have too much aspirin, you actually increase your risk of having a hemorrhagic stroke.
Okay.
So that's where you've got to be careful.
Get the balance right.
Yeah. Whereas in men who've had ischemic strokes, aspirin has, despite the fact that men are put on aspirin, it's not been proven to prevent a second stroke. Okay. But being put on a statin drug for lowering cholesterol has been shown to decrease the chance of a second stroke in ischemic strokes, regardless of your cholesterol level. And strangely, men who've got high blood pressure and low cholesterol are more at risk of a hemorrhagic stroke than men who've got high blood pressure and high cholesterol. So it depends on the type of stroke and things and what you do and what you need to do. But basically, statins seem to help, because statins don't just lower cholesterol, they seem to also help stop some forms of stickiness and other things happening as well. So that's the medication side of things. But when it comes to actually preventing a second stroke nutritionally, there's actually I always have to write this down, so bear with me. Okay.
While you're just looking for your notes, just to really sort of clarify, really for anyone who's concerned about this, obviously it sounds like medicine, GP is definitely a route to be going and looking. So please do hear what Chris is saying, but discuss it with your GP.
Yes, there's so what was the basically if you've had an ischemic stroke, then definitely taking, I mean, doctors are keen on giving blood thinners, but omega-3 supplements have been shown in high dose to actually work just as well as blood thinners, but they probably have lots of other beneficial effects as well. Vitamin K2 can help because it can help remove calcium from the artery walls as well, and it can help stop clotting from happening. Now, there's something called, which I use in the clinic here for pain relief. The short name is PEA, so spelt P, but with capital letters. And that's been shown to really help with nerve regeneration in both forms of stroke, because it helps decrease inflammation. And after you've had a stroke, whatever kind of stroke, one of the best things you can do is reduce inflammation. And PEA tends to be good for both forms of stroke. And it's also good for nerve pain as well. And then some other things like magnesium, ginger, garlic, eating lots of herbs and spices, that can help after both forms of stroke. But after a hemorrhagic stroke, vitamin B12, vitamin B6, P5P, betaine, what are called methylators. So a lot of people with heart disease and heart problems have high levels of a particular chemical in their body called homocysteine, which you can get tested for, but most doctors don't seem to test for homocysteine because there's no drug that lowers it. It's only lowered by vitamins and minerals and nutrients. And if you have got these vitamins and minerals and nutrients going in your body in the first place, then you're probably less likely to have a stroke. So getting a homocysteine blood test if you've got heart disease, heart risk factors, can be a really good test to have to prevent you even having a first stroke.
Is this something that actually you could get through your GP, or is it something you test separately for?
Yeah, no, the GP can do it, but most seem to be very unwilling to do it.
They need a nudge.
They need a nudge, and you can get them done privately as well.
Yeah.
It can be a good test to get done. But generally, if you're taking methylators, then your homocysteine should be okay. But there are some other blood tests and things that normally a GP does, but they don't necessarily understand what they mean, which is a real shock to me, because when I learned about blood chemistry, I was actually gobsmacked by how little understanding GPs and even cardiologists seem to have about the blood tests they do. Like how important it is to look at your cholesterol to HDL ratio. And your total cholesterol and HDL cholesterol is a high density lipoprotein, which is the good cholesterol per se. And the ratio is critical. And I see blood tests where this is off. It's even written on the actual blood test, this is wrong. But it will say no action. But it's like, well, actually, there's things you can do.
Yeah.
And the other one is the LDL, the bad cholesterol to good cholesterol ratio, because unfortunately, cholesterol-lowering drugs lower both forms of cholesterol, but there are some things you can take that raise the good cholesterol and lower the bad cholesterol.
Got you. Yeah.
There's something called the red cell distribution width,
Okay.
which is just known as RDW. And this is on a lot of blood tests, but it's completely ignored by medical doctors. And the ranges, it seems to be that if it's over 13%, then there's a risk for increased heart problems. And it's usually secondary to nutritional deficiencies.
Okay.
And it's missed. And then another big one, how your immune system is working is an indicator of inflammation. Inflammation is an indicator of things like high blood pressure, risks for stroke. And you look at what's called neutrophils and lymphocytes, which are part of the white blood cells that are on a normal blood test that most people have had. And your neutrophils and white and lymphocytes should be a ratio of 2 neutrophils to 1 lymphocyte. Okay. And if it's not a 2-to-1 ratio, if the neutrophils are much higher, or if the lymphocytes are getting closer to a 1-to-1 ratio, then it's a sign there's a problem that needs addressing. But again, doctors don't seem to understand this, which is bizarre because it's all in the medical literature. So there's all kinds of warning signs that people can see on blood tests years before they have a problem, that they've got some kind of heart disease inflammation problem, not necessarily stroke, but something, and there's something they can do.
And that's the thing. It's good to know, because
Yes.
if you, let's say, we do put our trust in doctors. Most people do, and if we don't know what to ask for, sometimes the doctor's not testing for something that we would like them to be testing for, which would give us that peace of mind and security. So from what Chris is saying here, if you've got concerns, go give your doctor a nudge for sure. Chris, for someone who has had a stroke, why might they be feeling sort of tired weeks afterwards, and what could they do to restore their energy?
Okay, so when it's just weakness generally and fatigue rather than one side of the body not working, then very often it's likely to do with something called your mitochondria. Now, the mitochondria are basically the factories of your cells. They're the things inside your cells, whether it's a brain cell, a nerve cell, a muscle cell, a liver cell. It's the thing that creates energy, or most of the energy of your body. And so if you're generally feeling fatigued, it could be that there's been such a shock on your system that all of your energies, factories and power plants have basically decided to shut down a bit. Or it can just be that the brain's mitochondria are shut down, and that can cause a lot of fatigue and muscle weakness, even though it's just in the brain. So doing things to basically help your mitochondria get better. And so the things that mitochondria need in order to make energy is they need oxygen and they need micronutrients, so vitamins and minerals. And so very basic, as long as it's, again, it depends on what medication people are on, but for most medications, a simple, not too high a dose multivitamin mineral, probably best without iron as well, because iron can actually cause some more brain inflammation. So if someone's had a stroke and you want to give them a multivitamin, I'd probably recommend one without iron, just to be safe. But a low level one, or maybe get them to split it in half and take it in a little bit throughout the day. And lots of deep breathing. And there are deep breathing exercises like the Wim Hof program, or just trying to get out of breath just by doing the breathing, but make sure you don't get dizzy and fall over. So do it seated, and just doing lots of deep breathing to get more oxygen, get more micronutrients in to deliver oxygen. And quite critically, probably something called coenzyme Q10. Coenzyme Q10 is one of the things that as we age, we make less of. And coenzyme Q10 is often linked with low energy, poor mitochondrial function, and better recovery from strokes and all kinds of things. So those are my normal ones. There is one other thing that I tend to recommend to everybody, and this may actually help prevent the damage, the severity of a stroke as well. There's a particular Chinese medicinal mushroom called Ganoderma lucidum, and its Japanese name is the reishi mushroom, which more people have heard of the reishi mushroom. But you must make sure it's organic, and you must make sure it's from a firm that can actually prove that what's in there is organic Ganoderma lucidum, because lots of firms say they've got Ganoderma in their pills and it turns out they've got none. So I only use one brand because I know what works. But Ganoderma is really good for the nervous system and the brain and bringing down inflammation. And it also seems to be protective against injury. So if it's already in your body when you have a stroke, it may be less likely that you'll have a bad stroke.
Got you.
So that's one of my top things, and I take it every single day because it protects against pollution and liver damage and other things.
This is a powder form that you take it in, is it?
You take it in a pill.
Yeah.
And it's best heated up. So I actually have it already in. I actually buy it already in a coffee, but you can also open it and stick it in any hot drink or warm water. Yeah. You can have it with cold water, but when it's heated up, it has a much better effect.
Sure. Okay.
So I start my day with it.
Kick your day off. So Chris, we always like to make this practical. You've given us loads of great information here. So what would be something that we could do, that we could take away from this as a small challenge?
Okay, well, there's one is get yourself some Ganoderma lucidum and take it every day. Make sure it's organic for a month and see how you feel, because it's got so many different effects through the body. Some people can actually go, oh, right, okay. Pains can disappear, their brain can work better. But one of the things I recommend for everyone to try out is boosting nitric oxide. And nitric oxide is thought to be the link between why air pollution can cause heart disease and so many problems. Air pollution seems to disable nitric oxide. Nitric oxide is needed to relax blood arteries. It's very important for the brain to work properly. And so eating a diet rich in things that help you make nitric oxide, and you can actually Google this as well, or I can give you a link of all my resources as well if you want. There's food that you can eat that boosts nitric oxide, that's safe, that's not going to over boost it. There are some little exercises, because again, as I said, low level of exercise can be a problem, but too much exercise can be a problem as well. And so there are some simple exercises that you do in tiny bursts that aren't too strenuous, that help shake loose nitric oxide in your body. So there's some food, there's some exercises, there's even some breathing exercises. Humming every day can boost your nitric oxide and be good for your brain as well, which is a surprise. And there are some supplements as well that you can take as well, but I like to encourage people to eat nitric oxide boosting foods like beetroot. So the simplest thing would be drink a glass of beetroot juice every day for the next month and see how you feel.
Nice one. Chris, thank you. Always appreciate your time.
That's right. Thank you, Neil.
At the end of each interview, I ask our experts to leave us with a challenge. It's just something that we can try. If it works for you and you like it, just keep doing it. If it doesn't work for you, then just throw the idea out and keep looking for something that does work for you. I'm going to be trying this week's challenge. You can see my findings from this challenge in our challenge roundup video, which is a monthly summary covering all of the challenges our experts have shared. To get that video and all of our latest health and wellness uploads, including interviews and reviews, subscribe and hit the bell so you get notified whenever we post. And if this channel can help your friends and family, please share it with them too. If you want to get proactive with your health, Total Wellness Club are developing health quests over at questly.life. Join while we're developing the site and get access to health quests that immediately personalise your health. You'll get to identify which of 10 critical health categories need your attention. You'll be able to track your progress, and you'll be able to help us develop the platform too. I'll put a link in the description, and I'll see you in the next video.